Hello friends, this video is being presented by tpncare.com. Today I want to share with you how I got a blood infection through my PICC line. Following the vein stenosis in my upper right arm, I got a new catheter placed in my left arm because the incision in the vein was jagged. So the PICC line migrated out by a few centimeters. The radiology team in the hospital placed a new catheter in the same vein, but due to their negligence and in spite of assertions about leaving the tip of the PICC line in the mid or lower SVC, the head of the department still decided to leave the tip of the catheter in the upper SVC. The mid and lower SVC is an ideal place for infusion of TPN contents because of higher blood volume in that area. As a result, when I would run the infusion, there would be reverse flow from the upper SVC towards the subclavian vein of my right arm, which, as mentioned in my previous video, has stenosis. Every time I would run the infusion, it was extremely scary and unmanageable because I would experience severe symptoms in my right arm and the clavicle area. Please be aware that you avoid getting into a similar situation. Consult the medical professionals who have experience, expertise, and training of dealing with PICC lines. So I suffered for 6 weeks when I made yet another trip to the hospital, and the same doctor placed a new Groschonk catheter in the same vein, but this time they did not give me the antibiotic to prevent line infection, although I had requested for the same. It was another negligence on their part. In my case, I was usually administered antibiotics during the procedures. Within 24 hours, I had developed serious symptoms of blood infection through my catheter. And the very next morning, I immediately rushed to the emergency room with my family members and had to get admitted to the hospital for antibiotic and IV fluid treatment because they found out that I had developed blood infection and I had a bacteria in my blood. I was discharged after a few days and I continued the treatment and infusion both at home. My agency took over from there and continued to send me the necessary equipment, supplies, infusion bags, and the medication that I needed to cope with the infection. Unfortunately for me, I already had a frail body, and this infection left me in a state of extreme weakness for the rest of the year. To deal with the infection and any secondary symptoms, I went to a center in my area to get vitamin C IVs because when a patient gets a lot of vitamin C administered, it can help boost the immunity. However, it has to be done under the supervision and prescription by a physician after a thorough checkup. So please use your judgment and discretion because every patient is unique and have a different medical diagnosis. Thanks for listening.